Hello everyone, welcome back to my channel. Today's topic is otosclerosis. Let's get started with the video. Otosclerosis is a disease condition in which inner ear is unable to amplify the sound, resulting in hearing loss. Amplifying the sound means taking the sound wave to a place where it will get converted into sound perception. That means the place where the neurons contact with the ear. There are three small bones in inner ear that helps us to amplify the sound waves. So if there is any problem related to that bones, that is otosclerosis. Symptoms may be hearing loss, ringing or tinnitus in the ear. In very rare cases, vertigo might occur. It is also called as hardening of the ear with the hardening of stapes. The stapes also become immobile, which prevents the transmission of the sound as a vibration in the ear, leading to conductive hearing loss. This is a diagram of otosclerosis, where the three bones of the ears, malleus, incus, stapes, is unable to amplify the sound waves. There are types of otosclerosis. First is histological. This type does not produce any kind of symptoms but found during postmortem. During life, it is not found as a sign and symptom form, but after death, if there is postmortem done, then it can be found. In clinical otosclerosis, there is sign and symptoms, unlike histological. So this has three subtypes: stapedial, cochlear, and mixed. Stapedial produces ankylosis of the membranous labyrinth, while cochlear produces sensory neural deafness, and mixed has both the features. Etiology of this disease can be, first of all, genetic. If there is a fault in SCRPINF1 gene, then this disease can occur, otosclerosis can occur. Or if there is exposure to loud noise for a long time, that contributes to tinnitus. Also, viral infection can be a cause. Next can be risk factor. Risk factor, the people who are more likely to develop otosclerosis are women, person having a family history as a higher susceptibility, pregnant mothers. These can be risk factors. In pathology, first of all, risk or etiology can be a genetic defect, same SCRPINF gene. Because of that defect, there is hardening of the bones of inner ear that can occur at any age. Because of that bone hardening, there is a disturbance in the vibration of the bone, leading to conductive hearing loss. Clinical features can be gradual hearing loss, dizziness, tinnitus, roaring inside the ear, feeling like roaring inside the ear, buzzing inside the ear, vertigo, headache, and earache. We can diagnose otosclerosis by using history and physical examination. In history, we can ask about occupational exposure and any recent trauma. In physical examination, we can perform Weber's test and Rinne's test. The same tuning fork test. Audiometry test can be done. Tympanocentesis can be done, where we can visualize all the organ. Middle ear fluid can be provided if there is any fluid discharge, that can be provided for culture, or MRI of the whole bone can be done. General management can be controlling the symptoms, and we can treat the condition by using fluoride, calcium, and vitamin D, which supplies the parts of inner ear. Also, analgesics can be used like ibuprofen, acetaminophen. Hearing aid can be used to treat hearing loss if there is hearing loss, or if the patient is gradually losing the ability to hear. Any noisy environment should be avoided. Continuous exposure to such noisy environment should be avoided. Surgically, stapedectomy can be done, where the surgeon drills a hole at the stapes for the removal of affected part. As a nurse, all we can do is we can collect the history, provide comfortable position for the patient, a position in which if there is a drainage, that drainage can be passed out of the ear. Weber's test and Ringmay's test can be performed. Sign of nerve damage, like sign of hearing loss, sign of balance loss, should be assessed. Complications of otosclerosis can be complete deafness, nerve damage, infection to the inner ear, and blood clot in the ear after surgery. Thank you so much. Next topic will be discussed in further videos.